lens. He's entered the anterior chamber and already instilled viscoelastic gel to inflate the area. Now he instills hydrodissecting fluid that goes under the membrane, surrounds that thick nucleus in the center, and makes it loose. So now he's ready to disassemble the nucleus and remove it. This is the phaco handpiece, which is ultrasonic. It has a hollow tip that vibrates at 40,000 cycles per second as it emits ultrasonic waves. So he's making little indentations through the center. And then on the right, he'll insert the nucleus rotator. This allows him to rotate, divide, manipulate the nucleus until the fragments are very small. It makes them easy to vacuum. And he also irrigates inside of the capsule, which softens those fragments, makes them also easy to vacuum. Trying to get their attention because he likes to know when somebody's recording, but nobody's looking this way.
Oh, I'm sorry. That's okay.
He likes to know, so he's going to tell him. All right, so anyway, the nucleus has been removed. The softer and thinner part of the cataract still remains. It's called cortex. It's a soft, thin layer of cataract that lines this M&M-shaped membrane. So he doesn't need to break it up with an ultrasound. This instrument is non-ultrasonic. It will vacuum and irrigate. So as cortex is removed, the capsule will become bright and clear. It started off looking pretty cloudy. Once he gets it out, it'll be more like it was before she had a cataract. When it's clear, light can penetrate straight through the capsule all the way to the back of the eye where the retina is, and the retina is red. So that helps you see colors vividly and true. White's white again. You may have noticed that already with the other eye. It's just about all gone, almost. The cataract is now gone. He is going to instill viscoelastic gel, preparing that capsule for the cartridge that holds her new implant, the new lens. As the lens is implanted, it immediately unfolds and has two flexible arms attached. They're called haptics. That's how the lens stays in place. Inside of the capsule or bag are those little haptics. They flex against it. So he is going to withdraw the gel from the front and the back side of the lens before centering it directly behind that opening in the membrane that the laser created. It's perfectly round and precisely centered, so it makes a great guideline. That lens is the largest thing you're seeing there. I don't know if you can see it on there. That's just a sample of a lens to show you size, so you can see how tiny everything really is. Okay?
Mm-hmm.
So now he's going to pressurize to seal the incision. That means he's instilling saline into the anterior chamber. As it fills, it makes it snug along the limbus where it all comes together. So it's almost like a pressure seal in a very mild sense. So he taps on the eye to make sure it's watertight. Pressurize again, usually 2 or 3, sometimes 4 times. The little air bubbles in there will absorb. It's normal to have a few, and they do go away on their own. Taps on the eye again to make sure it's watertight. At the very end, he's blotting with a couple of sponges. And if they told him you're recording, he'll get real close at the end. He's still pressurizing. But as you know, he'll get real close, and then you can swing around for the thumbs up if you wish. He likes to do a nice little finale. So I'll get real close for you. Wow. And then you can swing around for the finale if you like. That's it. So I'll take you back to sit with her. She did great. All done. Let's see.
Let's see.